Hello everyone, this is Dr. Vikrant Shah. I'm a consulting physician and infectious diseases specialist at Zen Multi-speciality Hospital, Chembur. This gives me immense pleasure to talk to you all on this Antibiotic Awareness Week. It's a global health problem. It is much serious problem than anything else. You would be surprised to know few statistics which I'm going to put forward in front of you all. Annually, there are 7 lakh people die with antibiotic resistance, and there are exponential amount of death which is going to be seen by 2050 if the antibiotic resistance continues to grow the way it is going on right now. You would be shocked to know the motto which was given by Infectious Diseases Society of America, wherein they had said that developing countries like India, people will die with tonsillitis by 2025. It is a sentence by itself. Now, we cannot take it in literal sense that you will die because of tonsillitis. The basic gist in that profound sentence was that a simple infection like tonsillitis, there would be a scenario wherein your antibiotic would not work and people would succumb. So it is a profound sentence. We have to take it seriously. It is not just a problem with patients. It is problem with human being. It is problem with animals. It is problem with environment. You would be surprised to know that when antibiotic resistance starts building, we start seeing bugs like VRE in hospital drain. You know, the sewage drain, we started seeing these bugs, which is a known thing. There is a bug like salmonella which grows in animals as well and which becomes multi-drug resistance. And in environment, in the air, you have these bugs floating around. What is antibiotic resistance? It is a condition wherein the bugs become superior to your antibiotics. So antibiotics do not respond to that particular bug. And we gradually started seeing such bugs which we've not even heard about it. And those are creating a big difficulty in managing patients in the hospital, predominantly in the ICU. So why we are so responsible for it? We as a layman should understand that we have to get out of this myth that every fever requires antibiotic. Antibiotics are antibacterial drugs. Antibiotics are not antipyretics. Pyrexia is fever. The drugs which we use to control fever are called as antipyretics. Now, antibiotics are not antipyretics. Easy to remember. A simple example I would like to give you. Simple throat infection. We get mild throat pain, not really with high-grade fever. You know, you consider taking antibiotic yourself. You feel that if I take antibiotic, I'm going to get recover faster, but that's a myth, and that is what leads to antibiotic resistance. Your pharyngitis, what we call test throat infection, could be a viral pharyngitis. We get common cold, which is a respiratory syncytial virus infection. So if there is a viral infection, you can't treat viral infection with antibiotics. Virus is a different organism than a bacteria. You require antibiotics for bacterial infection. If somebody is examined by a doctor, and since I'm giving an example of throat infection, if there is a tonsillitis, there are patches, follicles on the tonsils, you are getting cough with significant expectoration with yellow color, green color, rusty color, then it is a bacterial infection. Speak to your doctor and choose an appropriate antibiotic. So irrational use of antibiotic when antibiotic is not required can lead to antibiotic resistance. Few people do not believe in continuation of a dose. There is also the drug dosages has to be kept in mind. Like for a simple example, if you are using a drug like amoxicillin clavulic acid, you know, so many times we see adults coming to us taking 375 milligrams of amoxicillin clavulic combination. If you are above 50 kg of body weight, the standard dose for amoxicillin clavulic acid is 625 milligram 3 times a day. It has to be at least continued for 5 days when it is justifiable to take antibiotics and it is required to take antibiotic. But few people feel better and they stop antibiotic in 2 days time. So this is how it leads to antibiotic resistance. There is also, it is not only the cross infection which is from one person to another person. We have seen Antibiotic resistance is acquired from human being to human being. It is acquired from animals to human being. So it is definitely, we can in a way call it as contagious, though literally scientifically we cannot say contagious means one infection giving another infection to another human being across infection, but it is given from one person to another person, so which is a big problem. So we need to join our hands together for the noble cause, for ourselves, for society and for the environment. No use of irrational antibiotic. Antibiotics should be taken only when required, under doctor's supervision, in an appropriate dosages for the appropriate time period. So let us remember a big motto in our mind. It is no longer save tigers. Now save antibiotics should be the punchline. And with this, I thank you all for your kind patience. Have a good day.